Thank you everyone for tuning in. We are very excited today to do another clinical conversation. And today is going to be a topic that I think is very important and really new in the space, at least new to me. So we're going to be talking about healing across generations, unraveling the threads of intergenerational trauma. And we have a content expert here today, Alex Ribbentrop, who is a clinical social worker in private practice. And I will go ahead and introduce us, and then we will go ahead and jump into our conversation because I know you have tons of wonderful information to share.
Awesome.
So this is a little bit about me. I'm not going to go into it, but basically my background is I do many things. As I was just telling Alex, I do many, many, many things. So I am a child and adolescent therapist in DC. I'm also working on my play therapy credential. I use a lot of expressive arts. I founded Agents of Change Social Work Test Prep, and then obviously we have moved into the continuing education space. And then I am a doctorate of social work student at SUNY Buffalo, and some of my areas of interest, of course, are play therapy, tech, and innovation. So I do a lot around AI and how we can use AI to our advantage in social work practice. And then lastly, I am very passionate about multicultural supervision, clinical supervision, ethics, and making sure that diverse voices are supported, heard, and have equitable supervision and consultation. So that's just, I could go on and on about how I have so many interests, but that's just a little bit about me. And I will talk a little bit about Alex. He is a psychotherapist specializing in complex trauma, family, and recovery. He's a licensed clinical social worker in Virginia and Florida, qualified supervisor, EMDR trained clinician, and a certified family trauma professional. He is the founder of Live Free Psychotherapy, a practice providing psychotherapy and clinical consultation within Palm Beach County, Florida, and Northern Virginia. And a little bit about Alex's background, and I'm going to let you talk about this once we get into things, and I'm sure it will come up. And our past experiences always shape our current work. He worked in South Florida after graduate school during one of the most challenging periods of the opioid epidemic. He saw firsthand how overwhelmed the system was and how inadequate treatment options and approaches were in many ways. For him, it highlighted how much we have to learn and really spurred an interest in further understanding the etiology of presenting issues. This led him more and more into the role of intergenerational considerations in developmental and complex trauma. So we will definitely get into that in just a moment, but that's a little bit about Alex. And then lastly, we have to cover what we will be targeting today. So after this, you should be able to describe the concept and manifestations of intergenerational trauma, evaluate and embrace multidisciplinary approaches in trauma therapy, and identify and assess the role of societal factors in intergenerational trauma. And then why is this important? Of course, this is an incredibly important topic, but it really helps. Like I said, this is a newer concept to me, and I think there's a lot of information and research coming out about it. So first of all, it's important to know what it is and how it will present with our clients. And it helps us to get just a more holistic understanding of mental health, right? We see the person for all the systems that they live within. Cultural competency and clinical practice. I know we will get into this, but I'm sure there is a piece of intergenerational trauma that ties into cultural competency, cultural humility, people's past experiences, people's lived experiences. And then also it informs public health and social policy. And I'm sure there's a lot of advocacy work that needs to be done around this issue. So that's a little bit about where we're going to go today. So without further ado, welcome, Alex. We're very happy to have you and share your expertise with us today.
Yeah, thank you very much. I'm happy to be here and look forward to this conversation. Thanks.
Yeah. So before we jump into kind of the nitty-gritty of things, tell us a little bit about your journey and how you professionally got to where you are today.
Sure. So that's could be a very long story. The short version would be I never anticipated being in the mental health psychotherapy world. I was always interested in studying philosophy and pursuing that in one way, shape, or form as a career through a series of life events, including many poor decisions on my part. I was introduced to the therapy, mental health, recovery world, and it piqued my interest very simply. Uh, Learning about people and connecting with people was exceptionally interesting, fascinating, rewarding, and ultimately motivated me to pursue this career path, essentially. So that's the short version. There's a lot of twists and turns involved there, and how I got from point A to point B. But that's an overview.
Excellent. And everyone has twists and turns and ups and downs, and the map never gets from point A to point B the way we thought it would.
Certainly not a straight line. Right.
Yeah.
Absolutely. Yeah. Yeah.
And then tell us a little bit about your experience in grad school and your experience after grad school and how you kind of made it to the private practice world.
So grad school involved a little bit of a start and stop. And I took a year off in between basically my first and second years. That was, again, sort of exceptionally informative, challenging in a lot of ways, but informative, meaningful for sure. Overall, I think a generally positive experience there. I can't say a tremendous amount sort of negative in that regard. I think it was a lot of what you wanted to get out of it. So if you really, really wanted to dig in and pursue something, you could do that. If you didn't, then that was available as a route as well. When I finished graduate school, I was connected with some people that were working in South Florida, and reached out to them for job opportunities and options, and ultimately found a position working as a primary therapist at a treatment facility for drug and alcohol use disorder, whatever we call it now, and mental health considerations as well. And so that was really kind of, I wouldn't say it was the start of my career, because I had some experience before in sort of the social service, mental health realm, and then work in graduate school. But it was working in a place at a time that was intense in many ways. This is intense work regardless, but it was intense in many ways, in that South Florida was this a little bit of a Wild West treatment center hub, with a lot of really, really good people doing really, really good work, and a lot of people not doing that. And there was a influx of people coming to Florida, specifically Palm Beach County and Broward County, seeking treatment for primarily opiate use, stemming from what's been referred to as the opioid epidemic. This was 2013, 2014. And this is when I think a lot of I think my coworkers at that point were starting to first hear about fentanyl. And and I don't, in my world, that had never really been a thing. And just really staggering, shocking how deadly that it was. And you were working with people one week and you would hear that they were dead the next week, and it happened with increased frequency. So it's a part of this world and a part of this job. There was a definite increase in the severity of things, though, for sure. And that definitely piqued my interest in terms of what is going on. And it seems as though some of the understandings that we have are maybe not sufficient? And is there a way to develop a more thorough understanding of what is actually happening for folks, for us, that is driving this level of dependence?
Mhm.
Yep.
And then from there, how did you kind of find your niche to move into private practice? Because obviously
Yeah.
you're working very much with, addiction.
Yeah. Yep.
And then it seems like you kind of went to the underpinning of that, which is trauma,
Yep.
complex trauma, intergenerational
Yep.
trauma.
Yep. Um, I I feel very fortunate that I've been able to work with, uh, I think, some really, really talented, caring, and just very intelligent people that I have really just learned from and kind of followed, essentially. And a part of that led me to another position down there, another treatment setting, but working in a very intensive family program where we had an opportunity to do some really, really meaningful, very intense family system work. And that further informed and really crystallized
Mm,
the importance of family in all of this. Like, the general sort of treatment model is very historically uh, and presently, for a lot of different reasons, it's very individualized.
mm,
That's great. But because of time, resources, energy, 100 different reasons, there's not the time and space given to broader considerations. And so a lot of times you work in isolation with a person. It's kind of just, again, the nature of like what we're doing. I had this chance to do this much more comprehensive work, like legitimate family work, and it was incredibly effective. It was very, very hard, and just reinforced over and over again the power of patterns
mhm,
over time and across generations, and how that gets acted out relationally over and over and over again on very unconscious, implicit levels. Um, and so you have people going, what's wrong? What's going on? What's this? What's that? What's a diagnosis? What's this problem? What's that problem? And the underpinning of that, time and time again, was in these interactions, these patterns of coping, these patterns of relating, how these unconscious, implicit defenses manifest in different ways. And so I really got a clear picture of that, and um, eventually sort of made the decision, for a number of reasons, to move into private practice, and took that experience with me, for sure.
That's that's awesome and really helpful to see kind of your progression of starting in one area, but it
Yeah,
evolves, and it always is evolving. And it's interesting. I was taking notes as you were talking because some things came up for me. I think Western culture, United States, we are very individualistic,
sure,
which totally plays into what you said. Like, we're going to fix the person, but
sure,
people live
sure.
within families, they live within structures. And I work with a completely different population, children, but a lot of like the best work I do is when the family's involved.
Yeah,
It
absolutely.
that's
Yep.
just, and I tell parents, I say, you're going to get the most bang for your buck with all of us being involved here.
Yeah, it's so interesting. Something that sort of strikes me over and over again every time I kind of stumble upon a new perspective or awareness of something, it's never it's never some, and this is just my experience, never some like earth-shattering, mind-bending insight. It's, for me, it's always been something like, hey, generally speaking, if you get other members of a person's life to make some healthy changes, the chances of them making healthy change increases. That's, essentially some of what we're talking about. But the waters are so muddied, or become so muddied very quickly, again, for 1,000 different reasons that it becomes very hard to see that. But yeah, absolutely. Like the basic sort of fact of the matter is oftentimes you can say something to somebody 1,000 times, you can do all the work in the world. It really takes, and we would see this time and time again, it really takes 60 seconds in a room with a family member to undo a lot of work and for a system literally to revert back to its sort of most familiar state, good, bad, or indifferent.
Yeah.
Yeah.
I completely agree. And sometimes I feel very stuck as someone also that's in private practice. Like we need to get the family members involved here because we're just spinning our wheels sometimes. And it's like and sometimes the client has done the work and it's like that only gets you so far. And now we got to kind of do the work together.
Yep.
So I think no matter what population we work with, we see this as a pattern, even obviously with children all the way through old age.
Absolutely. Yeah, absolutely.
So now let's get into kind of this term intergenerational trauma.
Sure.
What does that mean to you? How do you see it? How does it come up for you? Like I said, it's a newer term to me. So once you said it, once I learned it, I was like, this is not earth shattering, but it was so eye-opening. I was like, oh my goodness, this makes too much sense. Why have I not learned this before?
Right. Yeah, that's very similar to my experience. I think essentially this concept is really is sort of woven into a lot of practice and theory. We're just not sort of directly discussing the concept or fully meshing it out. I think for me, there's a couple meanings. One is a view of presenting issues as stemming from, in one way, shape, or form, defenses that emerged early on due to interpersonal connection. And this is, again, not earth-shattering, it's not new. This is an idea that's, every different modality has its sort of a different version of this perspective. Right. Early interactions with primary caregivers are very important. That's that. A little bit sort of deeper is, again, that a lot of this stuff is implicit, it's unconscious, and we can say that in a number of different ways. It's nervous system, it's it's polyvagal, it's unconscious input, like there's those are different way, a lot of times different sort of ways of approaching the same issue, is that we're not super aware of a lot of the things that trip us up, because in one way, shape, or form, they are deeply connected to survival mechanisms that are neurobiological and have evolved over a really, really long period of time. And that's another more extreme way of talking about intergenerational considerations, is that the stuff that shows up really is this proverbial tip of the iceberg that has been at work in building and being reinforced for a very, very long time. So by the time we have somebody presenting with a substance use issue that's potentially deadly, that is deadly if it goes untreated, right? That's a wave that's been traveling a long distance. And again, oftentimes a consequence of a pattern that has been sort of reinforced and passed down for decades, generations, etc., in one way, shape, or form. Again, it doesn't usually strike us before it gets to that point, because a lot of the issues that cause stress and then anxiety and then prompt defense mechanisms are just happening within our systems, just happening through interactions with family members and people in close proximity to us.
That was super helpful explanation. And I'm sure some of our listeners will be thinking of this too. Whatever orientation you're from, I was like, when you were saying it's our relationships with people, I was writing attachment theory, because for me, I'm attachment theory. And it's like, that could, we all have our attachment styles.
Yep.
Parents had attachment styles. So I think you are so right on by saying this is embedded in all the theories, but we're just drawing more direct attention to it versus like maybe mentioning it in passing.
Right.
And how you're actually unpacking that and what that means.
Attempting to somewhat. Yeah, exactly. Yeah. Absolutely.
That leads me to my next question. So you see these patterns. What are some challenges that you face when kind of unpacking this or trying to unpack it? Is there some defensiveness? Because I don't know, but I can imagine that there's maybe some like shame, or I did this thing and now it's causing all of this. So how do you approach it in a way that it's not trying to place blame on anyone?
It's a great question, and that's a sort of a point where in my mind we begin to move a little bit away from, or we start moving away from these broader kind of theoretical considerations and more into the clinical application. And that involves, again, whatever sort of orientation a person comes from or modality they're drawing from, that becomes then this element of assessment and individualized care and approach. Generally speaking, the closer that we get to a hurt, a wound that needs healing, defenses increase. And so our job as clinicians or members of a team is attempting to figure out what approach is going to make the most sense for this person or this system, at this time. So it really brings me back to, like, at that point, what do we mean by individualized care? What are we doing with the resources that we have available to pick where we want to put our time and energy? And that opens up, another huge conversation.
Yeah, just kind of going off of that. Do you ever see that you start to do this work and then it's opening so many other doors for maybe other family members getting into their own individual sessions with clinicians? Because it's just like, I always say, you don't know what you don't know. And then when it's brought in front of you, you're like, oh, I have a lot of work that I could do as well.
It's sort of almost the best case scenario, is that you're having, it's kind of this a little bit of a paradox, right? But that a healthy system creates healthy individuals, and healthy individuals create healthy systems. So if we can have a weave where perhaps you're doing some more connected family work, and that results in people investing in themselves in one way, shape, or form, it's like, yeah, that's wonderful. In this one treatment setting where I worked, sometimes the goal really was just that, or that really was one of the best things you could have as a result of working with somebody, is that they were motivated to engage in some form of, not necessarily treatment, but some form of, I'm going to look at myself and attempt to take better care of myself. If you can make that move, as simple as it sounds, it's, it can be life-changing and life-saving. So yeah, it's a best case scenario in a lot of ways. Yeah.
If that would make our jobs a lot easier if everyone was finding, these outside ways to do the work.
Yeah. Absolutely. Yeah.
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 So I want to hear a little bit more about your work with the opioid epidemic. And you were saying that you saw this like family treatment model was very effective. So I want to hear a little bit more about how you dealt with this. Like you said, fentanyl was like not a drug of choice that was on anyone's radar really at that time. And it's really
Yeah.
hard to provide treatment when it's coming at you very intensely and you
Yep.
don't know that much about it.
Yep. Yeah. I mean, again, this is just one person's sort of eh,
Yeah.
experience, kind of anecdotally and professionally. But yeah, the a couple things. One is that the opioid epidemic label, a lot of obvious sort of time and energy has been spent on um pharmaceutical companies and
Mhm.
prescription practices. And I think that's well and good. I feel like it a little bit misses the mark in terms of, again, like why what are the underpinning reasons that this has exploded in the way that it has. um and for me, it seems to indicate that there's a large percentage of people that are acutely struggling
Mhm.
with a variety of issues, to the point where there's a really high level of susceptibility to substance use issues.
Mhm.
Um, and the fentanyl, I think, I'm not a total expert in this realm, but I think it really sort of emerged as restrictions were being made more and more on the actual pills
Yep.
and the prescription of the pills. So there had to be something to make up for that loss of supply. And the use of fentanyl has emerged as a result of that. And it's just become, it's a much more lethal drug, essentially. Um, Historically, there was not the same degree of lethality to even opiate addiction, or heroin addiction. You had overdoses, you had people dying, but not to this
Yeah.
degree. And so it changed the landscape of things. It changed the way that we did practice, because for me, I'll speak for myself again. For me, it became that much harder to talk about hardline, clear-cut boundaries with family members,
Mhm.
because there was a more of a reality that you would draw a boundary with somebody or say, you're not coming back, you're not doing this, and there is a chance that they're going to die. So all of that was existed. It's always been there. It was forced into our um, conversations more, much more.
And probably quickly. And it's felt like it came very suddenly.
It did it. That's exactly right. Yeah, that's exactly right. And in terms of working with families, again, you end up having a really broad spectrum of responses from people, um, between sort of, let's say, just denial on one end of the spectrum, and then hyper vigilance on the other end of the spectrum. And again, that then brings us into, what are we doing with this family and this individual at this point in time. Yeah.
Yeah. How much of at that time, like I think now people have a better understanding, but I still think there's a lot of work to be done. But or how was the government or the, political climate at the time kind of educating people about this? Because I know there was a ton of misconceptions. And how do you get that outreach to just get the basic information about opioids and fentanyl and the lethality? Because I think that was a big thing too. People didn't know that it was such a
Yeah.
deadly drug.
Yeah. Yeah. It definitely, interestingly, it does seem, all of this does seem to have promoted an increased awareness generally
Mhm.
of these issues. I think on some level, it's just sort of, it's demanded attention, because it has become and it has continued to be that serious of an issue. Um, so you do hear politicians using this as a talking point.
Yes.
Um, again, there's a big distance on a macro level and a micro level and everything in between. There's a big distance between talking and then action.
Doing.
And
Yeah.
yeah, and action that is helpful. Um, so I think it's there's a positive for sure in
Mhm.
that there's a much larger dialogue and awareness around, let's say, mental health and substance
Yeah.
use issues, et cetera. There's still a lack of awareness around what does any of this actually mean, and that's for the layperson, and that's for professionals as well. I mean, I think the
Yeah.
reality is, you know or again, I'll sort of speak for myself. I've been in this world for a minute, and I am sort of every day humbled by how little I know and how much there is to still attempt to understand about what is happening with some of this stuff. Um, so I don't know if that directly answered your
Yeah.
question. That's a bit of a
No, and
one, but
I
some thoughts.
also kind of have the same experience. The more years in I am to this work, I realize how much I don't know.
Yeah,
You
for sure.
graduate, you think, I know so much. I just,
Yeah,
went through school for these years. And then um, the more you're in it, you just see so many diverse experiences. And
yeah,
every day it feels like something new in some different manifestation or presentation is coming up. So I agree, like
yeah.
it's evolving, and you're going to meet so many people that come in at different levels, even of their basic understanding.
Right, right. Yeah. No, it's really sort of staggering. This isn't super, I don't know if it's super great self-promotion, but staggering how little I know, right? But I do, on the flip side of that, I think there is a positive there in that, um, definitely spurs a curiosity and a desire to continue learning and growing. Yeah, yeah, it's
Yeah.
humbling. Yeah.
Humbling. And I would like to know, when you were more in the community health setting,
Hmm.
how did you approach this from a multidisciplinary team? Like, were physicians involved? Like, who would be on the team? And I think
Sure.
sometimes the perspectives are very different between us as mental health professionals and maybe someone that's more from the medical model.
Yep, for sure. Boy, I have a lot of thoughts there. So that medical model is rooted in a lot of history. It's rooted in this mind body dualism dichotomy that's got a lot of ground underneath it. And I've said this a bunch today, but for a number of reasons, it remains uh, very much in play in how we view and how we view people, how we view care, and how we enact care. It's not an all in all terrible thing by any means. It does seem to be restrictive. Um, so when there is an opportunity to work more comprehensively with other professionals, again, really positive, refreshing experience. Obviously depends maybe on sort of personalities and
Yeah.
things like that, but generally speaking, your care is better.
Yeah.
The work improves, the care improves. I think we get into it, a dollars and cents and time and resources discussion very quickly with all of this. That's a major factor. I'm a social work student as well. And there was a lot of discussion about, how are we going to sort of solve and address these problems? And again, we can talk about 1,000 different really great solutions. There's a bottom line element involved in all of this. And so if we are not cognizant of that, and if we're not cognizant of making a case for why certain things are cost effective, we're going to have a hard time, enacting larger scale change. And I say that because my experience, and one person's experience, is that a place that allows for that type of team comprehensive care, that costs money.
Yes.
Right? That's a lot of money. The average person is getting a very, very small period of time from a provider that really is a lot of times attempting to do something like symptom alleviation, because we're just trying to quell whatever acute presenting issue there is.
Mm-hmm.
I by no means am saying like that's a bad thing. I think that's a necessary thing on many levels. There is definitely a broad spectrum in terms of how we could perhaps do things better. This is a much bigger policy issue that's outside of my realm. But I hope that as awareness increases, perhaps discussions like these increase as well.
And I think that we can only do so much given the systems that we work in, right? Like in a perfect world, it would look very differently, but that's not reality. And a lot of people, I'm just thinking to students, you usually go in a track. I'm the clinical track, I'm the macro track, but even though we do clinical work, there's macro policies and there's macro work that directly affects what we do on a day-to-day basis. So I always tell people, like, don't just be like, I don't ever want to do macro work, because it's all embedded in one way or another.
It's all, I mean, just like we're talking about the weave of the family and the individual. It's the same, it's the same, theory premise there as well. And this professor in grad school, and she always talked about the micro macro interweave. And again, it's like one thing to hear that and perhaps have some understanding of it, but it is a very real thing that has very real implications.
Absolutely. Changing gears a little bit for our last little part of our conversation, how does culture or client's background play into this work? Because I can imagine that it's very dependent on that. And how can clinicians or providers be humble with that and take that into account when doing the work?
That's a great question. So I don't know if this directly answers it, but one area that I've kind of stumbled upon when doing research, preparing for presentations, I end up doing research and going down these rabbit holes. And one area that I've stumbled upon, we talk about trauma and intergenerational trauma, and I've developed a little bit of a viewpoint of sort of like, well, no wonder, because it really was not that long ago, 3 or 4 generations, that something like the survival rate for kids was like 50%. So you had like a 50% chance of surviving to the age of 15. This isn't until like 1900 or something like that.
That's not that, if you think of it, that's really not that long ago.
It's not that long ago. That's like, grandparents, great-grandparents are living there, and again, sort of thinking more broadly, we're very fortunate where we are. We have, we have clean running water, and electricity for the most part. And, that is not the case for billions of people
Yeah.
on Earth in 2023. It was not the case for anybody on Earth, 200 years ago. And those are, to put it mildly, those are stressful circumstances, right? So everybody, we talk about, we talk about sort of the nervous system and fight, flight, freeze, and fawn. And a part of my brain is going, everybody has been in like a chronic state of survival mode for the majority of human history.
Mhm.
So that gets passed down. It's very powerful because it's connected to keeping us alive. And the consequences of some of that stuff shows up in things like anxiety, depression, or what we call anxiety, depression, substance use, etc. That's where my head goes in reference to that, is that, sort of no matter where we're coming from, there is a definite shared human experience that has been tough on many, many levels. Tougher for sure, depending on specifics, but from this mental health trauma perspective, we're all coming into this geared up and wired to be in one way, shape, or form in that sort of survival mode. So not a totally direct, but just definitely what I've seen, and maybe touches on that some.
And I think that's a good lens to see it through, knowing that we all have come from
Right.
this, but
Right.
then there's groups that have experienced the trauma at such higher rates. And
Right.
much more recently, I think of when my mom went to school and it was segregated, right? Like that,
Right.
my mother is still alive. Like, I
Right.
don't think
Right. Right.
I
Right.
think
Right. Right.
we try to speed things up like, oh, that was so long ago. It really was not.
Not that long ago. No,
It really was not.
no, that's a great point. And
Yeah.
even, you know, some of the folks, some of the most like interesting, just mind-blowing stories I've heard have been from folks that are, first generation immigrants. And um, I mean, just insane, like
Yeah.
the amount of just life and just
Survival,
yeah,
really.
survive, just like insane.
Mm-hmm.
Um, so, which again, is just very much everyday present across the world.
Yep.
So yeah, so go figure. Some of that stuff, uh, you know, has an
Excellent.
impact,
Yeah.
yeah, on how we function in the world. It's like, yeah, it's not earth shattering necessarily, but it's just this little shift for me that's been meaningful for sure.
And so much is biological. Like I have been learning a lot more about epigenetics and how it can affect our DNA when we experience these different things. And that alters, certain things. And it is actually at a genetic level passed down in some ways. And I think that's becoming a field that people are like kind of bridging that with the trauma piece, because there's so much more we need to learn about that over generations. And we haven't really had the opportunity to even do studies of that level where you're bringing in multiple generations, going down to the genetic level and seeing like what's going on DNA wise, gene wise.
Right. Yeah, there's been some interesting studies, especially on animals, that seem to really indicate the reality of that. I think it maybe is murkier when it comes to humans, but it definitely seems to be a thing. There's this study that I talk about, and I'm not doing it justice because you know, I'm not a geneticist, or
Right.
I'm not even really a smart person. So, but they did a study, this is years ago, they did a study on mice, I think mice, where they exposed them to a smell. They associated the smell with a shock. They removed the shock, exposed them to the smell, and there's still the stress response. So it's condition response. They then demonstrated that when they exposed the offspring of those mice to the smell, the offspring had a stress response
without even being exposed to it.
with having no prior experience of that smell. Amazing. And that not only that, but they saw structural changes in the brains of the mice. And those changes were in places associated with how we respond to stress and how we deal with smell. And that was passed down, I think, 3 generations, that response.
Amazing.
Crazy. So, we don't have as clear cut of a study in terms of humans, but I think there's fairness to believe that there's some parallels there. Absolutely. So definitely, or hopefully, a really positive line of thought and research and exploration that could absolutely be really helpful for a lot of people. So
I mean, there's so much. I think there's going to be so much that comes out in the next 10, 20, 30 years that we just don't know yet.
Yeah, for sure.
So I'm very excited to see like what goes on in that realm, because I think it could really inform our practice in ways that's going to make it where we can actually start to address some of these underlying things that we don't even know about yet.
Yep. No, it's a very good point, and definitely just sort of will be beyond interesting what's happening. A few years down the road, for sure.
The final thing I want to wrap up with, if someone's just getting their toes wet in intergenerational trauma, they're just like, this is so interesting, I think it's fascinating. What are some like resources, or how can people learn a little bit more about it? Just if you're just trying to understand better without getting like a super in-depth expertise on it.
It's a good question. Well, the first thing is if you're motivated or interested, you can absolutely attempt to sort of look at do some self-reflection, look at yourself and your family, and perhaps take into account some of what you know about parents and grandparents and their experiences and how they may have been informative.
There's a reason we do genograms in this field.
Exactly. Yeah. So that's definitely route number one. Usually sort of readily available. We are blessed and cursed to have the internet available. Generally speaking, there's a lot of really good information. One of the great things about this is that there are a lot of very smart people who are very talented and very motivated, doing really, really cool work. So, a Google search generally is not going to be terrible in terms of some introduction to concepts and theories and ideas. And then from there, I would encourage people to pursue what they're interested in, because at that point you're going to have 100 different avenues to travel down. So I would say sort of keep it simple. The next step would be, I think, reach out to people that do some of this work, reach out to an Alex or somebody else, whether that's for therapy or whether that's to get more specific resources or something like that. Because this is what we do, is we attempt to help people in one way, shape, or form, even if that is, saying, hey, why don't you give this a try and let me know if
Yeah.
I can do anything else. So,
Yeah.
yeah.
Yeah. And I think just from what I have reflected on is it's part of the work. So maybe taking a step out to zoom out and be like, where do I already do this work? And where can I,
Mm.
and under my own theoretical orientation, kind of think of this a little bit deeper.
Yes. Yeah. That's a great point. Absolutely.
Because like, even as I was just talking to you, I'm like making all these notes, like I do this and I need to learn more about this. And how can I use attachment theory to inform this? And
Yes.
lots of, like we said, it's not groundbreaking, but it's definitely an eye opener.
Yeah, I think that's a very well described overview, for sure. And exactly right, that generally speaking, everybody for the most part is doing versions of this. Um, we're just sort of piecing some bigger ideas together, maybe. Yeah.
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 Well, I just wanted to say, I mean, we could go on forever about this because it's so
Yeah.
interesting and it
Yeah.
could go down so many routes, but I really want to thank you for taking the time to share your expertise with us.
Thank
And
you.
I am super interested in this area. So I hope that other people kind of got a nice intro into it and it's helping them think a little bit differently, maybe about some of the work that
Sure.
you're doing. Because I say you can't go into mental health and not experience someone that's had trauma in some way, shape, or form. It's part of the human experience.
Yep. Yeah. I think that's, again, very well said and seems to be a fundamental truth.
Yeah.
Yeah,
Yeah.
absolutely.
And
Yeah.
I have here some different studies if people are interested on
Mm-hmm.
some of my own research I have tapped into. And as you can see, they're all pretty fairly new, 2018 and up. So this work is coming out in
Yep.
larger research quantities as we start to learn more.
Yep.
And Alex, I just wanted to thank you again for taking the time today. And it was great getting to pick your brain a little bit more.
Yeah, thank you so much. I really do. I appreciate it. It's a lot of fun. And anything I can do to be of support, don't hesitate to let me know. Thank you.
Absolutely. Thank you.
Awesome. Thanks.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.